It is an honor to be with you. Our apologies, a number of us on the City Council were just at an event at Bartle Hall, but we are so happy, excited to be here with you today to discuss and to really get a chance to further share the importance of this great program. I want to thank my friends from the Kansas City Public Library, its executive director, and so many others who are here. Let's give them a round of applause. We're going to clap for them and what they do every day in our community. I think it's clear to say that our current system is failing. Incarceration is not alone effective in solving a number of the issues our community faces each day. I was just talking to Councilman Duncan about this very fact. If you go on the streets, if you talk to some of our folks who have been in and out of the carceral system, they say they have been arrested 25, 50, 75, 100, some people 200 times. After a while, what does that tell you? For some, they would say, oh, it says you should just put them away longer. But I ask you this, do you put somebody away for longer when they have shown many times it is a substance abuse issue? It is an issue where we need to make sure somebody gets connected to services. If it is somebody who's a trespass, if it's somebody who has had issues with addiction or dependency, or if they find themselves in crisis on our streets, the best thing we can do is help get them to solutions. Get them to solutions that help allow them to be healthier, allow them to grow stronger, and more than anything, allow them to live productive lives in our community. This is exactly what the REACH program does. It connects those who are experiencing a crisis related to substance abuse, mental health, and homelessness with services, resources, and other basic needs instead of arrest. Our strategy is to shift responsibility, not necessarily to shift it, but to make sure that we're sharing responsibility for better days in our community with our mental health apparatus, with the resources in this community each and every day. The police chief, so many others on the enforcement side say you can't just arrest yourself out of the problem. You need to make sure that we're finding ways to address these issues long term. We're launching our first REACH pilot right here on the Prospect Avenue corridor, from 27th Street to 45th Street, which we have identified over the years as a high spot for high crime in Kansas City. Over the months ahead, Kansas City's Health Department, KCPD, KCFD, 311, Decarcerate KC, the 988 ComCare, Mental Crisis Line, and other local organizations are working together to ensure this program is successful. So how can you help if you're from the community? If you know someone who is struggling, you can call REACH. That's at 513-6010. Or you can go to kcmo.gov/REACH. I hope, by the way, this goes to our highest ranking city staff, which I believe is the health director. Make sure we make that available on the My KCMO app as well. So if people are in crisis, you find a way that you can help them receive the support and the resources that they need. A few people I want to thank in this endeavor. First of all, a lot of you in this room have been part of this process. And I'll be just straight up. I didn't agree with this process the whole time. I'm somebody who was raised a certain way, that right, you call 911, you have this solution, you got to just figure it out through a very structured way. Like everything, I was able to learn. I was able to learn in this process about how are we actually making a difference. Not just solving a problem for today, that is still a challenge tomorrow, but how do we help support and build better lives long term? So to everyone who had some role in this discussion, I say thank you. I may not know your names, but please know that you're appreciated. To my sisters and brothers in Kansas City's Health Department, who we throw almost every issue at, thank you for addressing it in a structured, thoughtful way that is difference-making for all of us. And I also want to thank my colleagues on the City Council. The sponsors of this ordinance, I think, did outstanding work. I think it's fair to say the lead sponsor was Jonathan Duncan of the 6th District in District. And only about a year and a half in office, even less than that, he has somebody who has come up with transformative ways that we can make Kansas City better long term. There have been council members and mayors who've been talking about jails and arrests and all that noise since the founding of this city. There have not been people who talking about how we can make a difference long term. So I thank you, Councilman, for being part of that. And I believe, kind of given where we are in our order, probably the councilman is next.
I first want to thank the community organizers who pushed me to do this so early. As a newly elected city council member, I didn't hesitate I was firmly on the ground, 10 toes down of like who I am and what I believe in. I say often that the line between me being a city councilman standing in front of you at this podium or being dead or in jail was incredibly thin. And it was people in my community who poured into me to ensure that I was able to heal and that I was on this path and to be this person that I am in front of you today. We spend $318 million on enforcement a year. We have an additional money for our courts, and we just left a roundtable with community improvement districts that in total are spending millions of dollars more on enforcement. When we think about how much money we are spending on other things, the issues of poverty, public health, housing, connecting people to these resources, what are the resources are we connecting them to? We just funded our first low barrier shelter. Y'all, it's 2024. We have to do better. This solution is not the solution. It is not going to solve all of our city's public safety problems, but it is a first step. It is a first step to addressing these problems with more than a hammer. Because if the only tool you have is a hammer, all the problems are a nail. And our people are not nails. They do not deserve to be hammered. They deserve to be poured into. And I challenge everyone to think about, what does public safety mean? What does public safety mean? Thank you to Decarcerate, because one of their mantras is reimagining public safety. It's important that we think about a holistic view of what public safety means. And as the mayor stated, our health department is always running point on reimagining about what we can do to better take care of our people. This is what this program is about, connecting our people to resources, and then we're going to have a feedback loop of saying, what are the gaps in those resources? And that's going to push us to be better and better fund those resources. So I'm looking forward to this pilot program. I think it is a necessary first step to really addressing and taking care of our people. I want to thank everybody who provided very vulnerable testimony of what the carceral system has done to them and their families. I want to continue the people in this room to talk to others and be vulnerable about what we can do better. We know better now, so we have to do better. So thank you. I think with that, I will pass it along to Councilwoman Patterson-Hasley.
Good afternoon. How's everybody doing?
Good afternoon.
So first of all, thank you for giving me an opportunity to speak. I wasn't planning to be on the agenda this morning, but absolutely knew it was necessary to stop by the 3rd District to greet you all and to also thank Councilman Duncan and the rest of my colleagues for having the foresight to institute something like the REACH program. When you did bring this to our attention, I think it was new to everyone, as the mayor mentioned, but you did a great job of explaining your vision and the impact that it could have. And so this is another example, I think, as our intention as a council to expand the definition of public safety. From my colleagues joining Councilwoman Robinson and I in finding funding for the Eastside Can Center right across the street, and also recently financially bolstering the grocery store behind us, Sunfresh. In the coming weeks, I have decided I'm going to begin shining a light more purposefully on the effects of the concentration of poverty, and looking to one part of the city as a place to ignore or exacerbate our society's biggest woes. So programs like this do provide support to help people make their way toward a better life, and it's paramount that we continue to do this type of work and that we continue to make investments in a part of the community that has not had those types of investment. Is because this is what we end up having to do later on. We have these big problems that we have to solve. I think that this council is uniquely poised to begin looking at our investments in a different way so that we can have one city, that is united, and that we can go to any part of the city and get the best amenities, the best services, the best education, the best public infrastructure, and it doesn't matter where you are. And so again, I want to thank Councilman Duncan for a program like this, and I hope that we continue to work together to make our city a place where everyone thrives no matter what zip code you're in. So, thank you.
I appreciate all the speakers that have gone before me. I appreciate the support from the city manager's office, who is really excited about this, as well as our mayor and council. Thank you for being here today and sharing your support. I also want to give a big thanks to all of my team members. This is a huge undertaking. It's something new, somewhat exhilarating and a little scary in a different way because it's something we have not done before in this city. So having people like Deputy Dillard and Rashid Junaid, our division manager, as well as our Governing for America fellows, Keegan and Marcel, and Ursula, who has been operating as the program manager, Ursula Copeland. I just want to thank everyone for this huge undertaking and stepping out on this journey with me. Thank you to all of our social service partners who sometimes have felt unacknowledged across the city in terms of seeing what you're doing and knowing what you're doing and being a part of it. This effort is not to supplant those efforts at all. Rather, it is to come alongside you and be better coordinated partners and collaborators in the work that we are all doing. So I want to thank you for that. So working with people who have been trapped in a cycle of involvement with the carceral system is a public health issue. It is something that we should care about because not only does it impact those of us who are seeing and observing, but it's also those people and their families who have lost their ability to see them as contributors to our community. We have a lot of needs. We're going to invite you all to share with your partners and people you know in your networks about this program because we need people to work with us. So we are especially looking for people who have lived experience or who know people who have been caught in this system and who have, through uplift and support, been able to move past it. We want to welcome you to join us. We are recruiting. The post is listed on the website, www.kcmo.gov, and you can look under the careers tab and you can find this opportunity for REACH. Our team is standing by to build positive relationships to help residents who are struggling with substance use, mental health issues, and extreme poverty without involving the criminal justice system. We know that that system is already working hard to address serious matters, and where we can divert those people to other resources, that is where we would like to step in. Instead of treating these issues as crimes, the goal is to provide and help people get the help they need for a better quality of life. If you know someone who needs help, as has been mentioned before, please contact the REACH program at 816-513-6010, or you can visit kcmo.gov/REACH. Your involvement can make a difference, and this is a time for our community to turn toward people who are struggling and see them not as issues or people who can be ignored, but people who we can now offer some resources. Our outreach team is here ready to support you in your work. Thank you.